Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, if you've been listening to some of our interviews recently, you'll hear we're talking to all of our neonatal presentation presenters, and we're having such a fabulous time here, just connecting with some old friends, some new friends, and I'm delighted to say that we have Jillian Vinall Miller back with us here today. How are you doing, Jillian?
Doing great. So excited to be here.
Yeah. Now I know that this has been a life's work for you, working in pain management in the NICU, as well as some other great things that you're also doing. So inspiring, I have to say. You are always the gratitude that you have in the community is amazing as well. I know you work with students as well, which is fabulous. So in all of that to say, thank you for being able to make some time for us here at, of course, Gold Learning and Gold Neonatal. You're going to be presenting at our Gold Neonatal Conference coming up as part of one of our add-on packages, specifically, addressing pain and pain management. Once again, it's a very popular topic. Your presentation title, Memories of Pain in the NICU, the Impact on Infants and Parents. So I know that this is going to be a great topic for so many. Why this topic, Jillian? Tell me a little bit again about, the connection here, why it's important.
Yeah, it's a great question. I will say I started investigating pain in the NICU while I was doing my PhD training at the University of British Columbia under Dr. Ruth Grunow and Dr. Stephen Miller. And in their lab together, we were one of the first to really demonstrate that pain in the NICU is associated with long-term brain changes, as well as long-term effects on behavioral and cognitive changes in the infants. And so this really brought to the forefront that pain is a major problem in this population. Because I know when we started the work and speaking to a lot of other physicians, they didn't believe that pain over and above how young the babies were born, how sick they were, whether or not they had a brain injury would really matter, that a heel poke would matter. And so to bring that evidence to light was really astonishing for many of them. And it really launched pain management as being very important for protecting and optimizing the long-term development of premature babies. And then coming to the University of Calgary, when I was doing my postdoctoral work, I got to meet Dr. Melanie Knoll, who is another pediatric pain researcher, primarily in the area of chronic pain. But she has done some really seminal work to show how pain memories can really affect our future engagement with uh, participating in like healthcare utilization, vaccine avoidance, how we really engage with pain and our pain behaviors and our pain responses. And so we started looking together at the question of pain memories in the NICU and how that not only impacts the parents and their memories, but how it can begin ingrained in the cells of the babies leaving the NICU because they can't necessarily remember their experiences.
Right.
It can come into their cells. Yeah.
Wow, that's fascinating. So this really sort of, leads into sort of our question we were discussing earlier about sort of the long-term impacts on both infants and parents. And I feel like for the longest time, when we started talking about pain, often, we were starting to get it a little bit right with their infants, but the parents have really been left out, in the left lane somewhere, and not really regarded in this manner. But that's not true anymore. We're starting to see that come around, right?
I 100% agree. So that was a really important finding from the work that I did with Melanie Knoll and Dr. Marcia Yeo Campbell out of a study that was primarily conducted in Halifax. And we were able to show that um, mothers' memories of the pain experience in the NICU actually persist well beyond and are associated with post-traumatic stress symptoms in the mothers. And then there's been lots of other work from great people in the community to show that the post-traumatic stress in mothers from their NICU-related experience is really interferes with their ability to appropriately parent their child because of that stress just overwhelming them in their day-to-day lives with them. And it's unfortunate because we know the parent is such an important person in an infant's life for being able
Sure.
to ameliorate their outcomes and optimize their neurodevelopment. And so we need to consider both the parent and the infant in our care models and treat them both because that's the best way to get the most optimal outcomes for these kids.
Now that is such incredible work and news, I have to say. So, and that just really struck me in my heart. I'm a NICU parent, and so, so not only do I work with families, but that really resonated with me, because I know the impact. I know what has happened. We're still undoing it. It's been some time since my son was in the NICU, but there are still things. And fortunately, I'm surrounded by such great healthcare workers like yourself, and professionals who are researching this all the time. No guilt, no shame. There's none of those things. It's really just an understanding and knowledge, and I think it's so powerful because if parents don't know, if they're not equipped or they don't understand, they're never giving themselves the permission to learn, because they just don't know. So that is, my goodness, such incredible work, Jillian, just amazing. Thank you so much again for sharing that. And I know, we'll talk more about that in the research as well.
Yeah.
So,
I just
going on, oh, go ahead, go ahead.
I just
Yeah.
want to say on that note, I really just think you talking about being a parent in the NICU just brought to the front of my mind is really where a lot of this research emerged from. And it's from parental advocacy, from parents wanting and saying, I want to be involved in my child's pain care. I want to know what's happening. And the research showing that when we do involve parents in their care, in the decision making, that this decreases their distress and improves their
Right.
outcome. And so, really glad for the parents who are always like pushing forward a lot of this research and direction.
Mm,
It's the whole reason why the field of pediatric pain emerged. And so
right.
I can't say enough about what we can learn from the parent experts in the room. Yeah.
Wow, that's incredible. So if in fact we can equip parents, like because really, I mean, it's up to the professionals to pass this on, I always say, because, honestly, as a parent, you're just waiting to be directed. You don't know what you don't know in that moment. And it's already very much you're in a heightened, awareness. Fight or flight is happening. So it's really good as professionals if we can step in and we can now equip and hold space, right? Because we talk a lot about that here too. So tell me, when a parent is involved and doing their best, what are the type of outcomes we're seeing, Jillian? Like, is it that different? Give me a little bit inside scoop there.
It really is. And we've looked at this from many different angles now
Mm,
about how when parents are supported and that they're able to support their child, how that improves child outcomes. And so we see it an improvement in their child's brain connections. We see it in terms of their ability to regulate their stress hormones. We see it in the
mm,
child's ability to acquire, appropriate self-regulation in terms of their behavior. They experience less anxiety, less depressive symptoms, and also their ability to achieve in school. They have more optimal IQ levels
mm,
and more, like social skills and school success, all with the power of the parent and being able to, when the parent can manage their stress,
right.
they can help their child manage theirs as well. And so it's actually such a powerful intervention just to have the parents involved in the NICU and helping them manage their stress and fears around their child's health.
Oh my gosh. I literally, I think, how everything sort of comes to fruition in life. And we've been hearing and reading a lot about this. The research is very clear, like you said. It's sort of a full circle moment of understanding. However, my question to you now is, what can we do as teams? Like how can we pass this on? I recognize that this is a very fast-moving, fast-paced environment with so many aspects of happening, so many elements that we have to take care of. So give me just a small insight on what teams can do now to get the message clear, not only for like their staff involved, other people, but getting the message to the parents.
hmm Well, I think there has been a lot of improvement, as you said earlier in the interview, to uh, not only managing the infant, but also providing supports to the parents. And there's a lot
Mm,
of different models that have been tested, such as like family-centered care, family integrated care, trauma-centered care,
sure.
that are being tested to see how they can help support the parent in the NICU. And a lot of times, they find that these are very feasible, easy to implement. They're just, additional educational, emotional support programs adjunct to their regular care systems. And the parents respond very strongly to them. They say
Mm,
that it really helps them feel involved in their kids' care, understand what's happening to them, and it has been shown to reduce their stress after they leave the NICU, which is what the goal of these programs are.
right.
I will say, the system is burdened, as you alluded to.
Mm,
So, what I find really interesting in this study is that the more um, the more integrated, the more steps involved in the program seem to help most the moms that are most stressed. So we could do a really simple screener to figure out the parent's stress level at that current point in the NICU, to figure out maybe who
right.
needs more support and who needs a little less support, and using sort of the step care approach so that the ones who need the more support are getting it, and the one who need less are
Oh,
getting what
wow.
they need. And this would create less burden and make sure everyone is, getting what they need at the end of the day.
I think people would agree that that is probably the most ideal model, which is, yeah, I never actually even thought about that either, but it totally makes so much sense because we're not all made equally. We know that. And other people may have, more resiliency, like you said, overall, in order to cope with that very emotional situation.
And I don't even want to put it necessarily to resiliency. Like when kids are in the NICU, they can be in very different situations. Like some
Sure,
might be at a much, they're just in there for a quick checkup, whereas other ones can
that's true.
require
Yeah.
months and lots of procedures. And so parents could be very much appropriately stressed given their child's
Right.
state. And there's nothing wrong with them needing an additional support to help them through that time period. Yeah.
Yeah, absolutely. Lots of ups and downs always, in the NICU. Well, thank you so much, Jillian. This has been fabulous. I can't wait once again, to hear your full presentation. I know for folks listening into, they'll be able to come in, and as part of our conference this year, we have our pain add-on. You're going to be part of it with some other incredible speakers. So it's going to be a great way for folks to take a deep dive. Memories of pain in the NICU, the impact on infants and parents. Thank you so much to you, Jillian, for being with us here today. And it's great to have you back here at Gold.
Thanks so much. I'm so thankful.
And thank you so much to all of you for chiming in once again. It's great to have you here as part of these interviews. Make sure you leave your comments down below. We'll look forward to seeing you online. And of course, as part of our Gold Neonatal Conference, you can head over to the website right now to goldneonatal.com to get all the information and details coming up here very soon. Thank you once again for all being here today, and I'll see you soon. Bye-bye for now, everyone.